Lumbar disc herniation, or LDH, is a common orthopedic condition that affects millions worldwide. It's especially prevalent among people who perform repetitive heavy lifting or experience frequent spinal loading. LDH is a leading cause of chronic low back pain, particularly impacting women in their mid-40s. The pain and disability associated with LDH can be severe, often disrupting daily life and work. Traditionally, the focus has been on relieving pain quickly, but new research suggests that the story is more complex. Inflammation, long seen as the enemy, might actually play a dual role, causing pain but also helping the body heal. This sets the stage for a new way of thinking about treatment. Inflammation is at the heart of LDH. On one hand, it triggers pain by activating nerve pathways and releasing chemical mediators. On the other, it's essential for the body's natural repair process. Recent studies show that inflammation can drive the spontaneous resorption of herniated disc material in up to 90% of cases. This means that while inflammation causes discomfort, it also sets the stage for healing. The challenge for doctors and patients is to find a balance. How do we control pain without blocking the body's ability to repair itself? This question is at the core of the new inflammation preservation strategy. For years, the standard approach to LDH has been to suppress inflammation using medications like NSAIDs and glucocorticoids. These drugs are effective at reducing pain and swelling, offering much-needed relief. However, there's a catch. By blocking inflammation, these treatments may also interfere with the body's ability to clear away herniated disc material. This paradox has led researchers to question whether comprehensive suppression is always the best path. Could there be a way to relieve pain while still allowing the body's natural repair mechanisms to work? To the inflammation preservation strategy, or IPS. This innovative approach suggests that instead of completely shutting down inflammation, we should modulate it with precision. IPS recommends avoiding strong anti-inflammatory drugs during the acute phase of LDH, allowing the body's own repair processes to take place. The goal is to harness the beneficial aspects of inflammation, like clearing damaged tissue, while still managing pain. This represents a major shift from simply treating symptoms to actually promoting long-term healing. So how does inflammation help heal a herniated disc? The process begins with neovascularization, where new blood vessels form in response to injury. These vessels act as highways, bringing immune cells like macrophages to the site. Macrophages are key players. They break down damaged tissue and help clear debris. There are two main types, M1, which focuses on clearing out the damage, and M2, which promotes repair and regeneration. This coordinated response is essential for the disc to heal naturally. Macrophages can switch between two states, M1, which is pro-inflammatory and helps break down damaged tissue, and M2, which is anti-inflammatory and supports repair. This dynamic switching is called macrophage polarization. It's a finely tuned process. Too much M1 activity can cause excessive damage, while too much M2 can lead to incomplete repair. The body relies on a balance between these two states to ensure effective healing. IPS aims to support this balance, allowing inflammation to do its job without going overboard. Another key part of the healing process is the apoptosis-autophagy axis. Apoptosis is programmed cell death, which helps remove damaged cells, while autophagy is the cell's way of cleaning up and recycling components. Together, these processes clear out debris and set the stage for tissue remodeling. If either process is disrupted, healing can stall or go awry. IPS recognizes the importance of supporting these natural mechanisms, rather than suppressing them with broad anti-inflammatory drugs. Clinical studies back up the IPS approach. Research shows that patients who avoid strong anti-inflammatory drugs during the acute phase of LDH are more likely to experience significant disc resorption and long-term pain relief. In some studies, up to 100% of patients managed with IPS achieved resorption, compared to lower rates in those who received early anti-inflammatory medication. This evidence suggests that careful modulation of inflammation can lead to better outcomes than simply suppressing it. IPS isn't about ignoring pain, it's about using targeted interventions. For example, physical therapy, thermotherapy, and exercise can help manage symptoms without blocking the body's repair mechanisms. Newer techniques like image-guided drug delivery allow doctors to target inflammation precisely where it's needed. This way, the benefits of inflammation are preserved, while the risks of excessive pain or tissue damage are minimized. The future of LDH treatment is all about precision and personalization. Regenerative medicine is opening new doors for LDH treatment. Techniques like platelet-rich plasma (PRP), injections, and stem cell therapies are being used to modulate inflammation and promote tissue repair. Advanced biomaterials such as hydrogels and biosealants can deliver anti-inflammatory factors directly to the site of injury. These innovations help shift the balance toward healing, reducing the need for surgery and improving patient outcomes. The integration of IPS with regenerative medicine is a promising frontier. Looking ahead, the next step for IPS is dynamic inflammation phenotyping, using advanced technology to monitor inflammation in real time. Tools like PET-CT imaging, liquid biopsies, and nanosensors can track changes in the inflammatory microenvironment. This allows for truly personalized treatment, adjusting interventions based on each patient's unique response. As these technologies become more widely available, IPS will become even more precise and effective. Smart biomaterials are another exciting development. These materials can sense local inflammation levels and release therapeutic agents as needed. For example, hydrogels that respond to changes in the microenvironment can deliver anti-inflammatory factors or support tissue regeneration. This approach minimizes side effects and maximizes healing. The combination of IPS with smart biomaterials represents a new era in the management of LDH and other inflammatory conditions. IPS to become standard practice, robust clinical translation pathways are needed. This means developing guidelines for when and how to use IPS, training clinicians, and ensuring that new technologies are safe and effective. International collaboration and evidence-based research will be key to overcoming challenges and standardizing care. By integrating IPS in clinical workflows, we can move from a one-size-fits-all approach to truly individualized therapy. Inflammation preservation strategy marks a shift from simply relieving symptoms to actively promoting regeneration. By understanding and harnessing the dual role of inflammation, we can help patients not only feel better but also heal better. This approach reduces recurrence rates and improves long-term outcomes. It's a move toward disease-modifying therapy rather than just palliative care. The future of LDH management is bright with IPS at the forefront. Summary: the inflammation preservation strategy is transforming how we think about and treat lumbar disc herniation. By moving away from blanket suppression of inflammation and toward precision modulation, we can achieve better pain control and enhanced tissue healing. The integration of advanced monitoring, smart biomaterials, and regenerative medicine is paving the way for personalized, effective care. As research continues, IPS may become the gold standard for LDH management, offering hope and healing to millions.